Good evening. I'm John Danel. I'm the Regional Foundation Coordinator for Great Britain and Ireland. Welcome to this month's InFocus talk, the last episode of Series 1. I'll say more about Series 2 later. The InFocus talks are organised by the Rotary Foundation team together with our humanitarian service teams in Great Britain and Ireland. This evening we're covering the sixth of our area of focus, disease prevention and treatment. I shall now ask Bill Campbell, one of the joint leaders for the Humanitarian Services team, to introduce our speaker. Over to you, Bill.
Thanks, John, and good evening from me. This month's InFocus event takes a close look at the topic of disease prevention and treatment. And we're delighted to have with us Dr. Shobhna Shah, the co-chair for BAME in London and the BAME network. Dr. Shah is a London-based, highly experienced consultant in anaesthesia, in critical care and aviation medicine in both the National Health Service and in our armed forces. She's a specialist in mountain medicine and in diving medicine and has worked with the Helicopter Emergency Medical Service in London and set it up in its infancy and receiving the very coveted Blue Peter badge for introducing the service on the BBC programme. She actively engages with numerous platforms with her multilingual skills, including media during the current COVID pandemic. She's worked and is working with refugees from Afghanistan and currently in Ukraine. She joins us live from the Rotary International Convention in Houston. So please welcome Dr. Shobhna Shah.
Hello, and greetings from Texas. Thank you for inviting me to address this esteemed audience. I'm deeply honored to be here to speak about teamwork and success. As an anesthesiologist in an operating theatre environment, I know and I have advocated good teamwork as an essential ingredient. It's a key human factor in event response. Teamwork during crises is extremely important, and communications between an anaesthetist and a surgeon should remain open at all times. Team interaction is studied extensively in other complex worlds of aviation, of military, and perhaps most extensively in the space program. Now, since I have been here, I've actually visited the NASA space program and seen them at work, trying to experiment on the gravitation work that they have to do when they land on Mars. And it was very, very interesting indeed. 5 hours I spent there, it was not enough. I advocated thoroughly. Since last February, I have been busy working with International Rotary Fellowship of Healthcare Physicians. Here, my team is ever so slightly bigger on a global scale. This is not like an operating theatre scale. This is on a global scale. There is an overwhelming sense of enduring commitment to a set of values which created our international family of Rotarians to help Ukraine, its people, and to supply humanitarian aid, including medicines and medical devices, in this war-torn country. We work through several time zones on a daily basis and have forged strong bonds with each other. We all have the same ethos and work to support each other and to fulfill the needs of the Ukrainians. My background has been pivotal to help understand the needs of the doctors, the surgeons, pediatricians. Since last February, I have been busy working with the International Rotary Fellowship of Healthcare Physicians. I'm working in conjunction with a number of people. And here, my team is not just limited to an operating theatre. It is ever so slightly bigger on a global scale now. There is an overwhelming sense of enduring commitment to a set of values which created our international family of Rotarians to help Ukraine, its people, and to supply humanitarian aid, including medicines and medical devices, in the war-torn country of Ukraine. I am not yet a Rotarian, but I am intending to be one, especially after I have been to this convention, and it's opened my eyes to a whole new world. We work through several time zones whilst I'm working for giving the aid to Ukraine on a daily basis. And this was something that we had to learn, taking each other's timings into consideration. And we have forged very strong bonds indeed. And this has helped us to be able to have a successful projects that we take on to be able to supply medical products and medicines, and of course, other humanitarian aid as and when needed. I try and help out as much as I can on other forums as well, who are non-Rotary, and I'm keen to make sure that if I have the information, then I would like to be able to share it with the others so that everyone can come on the same platform and try and help. And because we work in this way, we have the same ethos. We work to support each other, just to fulfill the needs of this one country presently. And I'm very, very impressed about how the way in which this is progressing. My background has been pivotal to help understand the needs of the doctors and surgeons and pediatricians and neonatologists who are working tirelessly in Ukraine currently. And sometimes things get lost in translation when their needs are being transferred onto a transcripted list, and we try and make sense of it. And then we try and make sure that we have contacts with the doctors on the ground. So we have a possibility of actually talking to them. And here, WhatsApp and Telegram and other things have been so useful. We're thinking of bringing in augmented reality to be able to help them even operate and help them if in case they need any help with regards to rehabilitation afterwards. Already one team has started doing that, and that one is based in Germany, but is helping rehabilitation for prosthesis of limbs in Ukraine, which is an unfortunate byproduct of having a conflict zone in the country. And what I have seen, I want to tell you about the experience that I've just had with the convention. I have not seen a more helping ethos of these people. These people are Rotarians, are people of action, but they're also people of peace. And they want to be able to make sure that every country in the world does get their attention. At one point or the other, I have attended a few of the sessions. My only complaint is that I didn't have enough time to be able to attend much more than the ones that I have attended. Probably I've not done more than 10% of the entire program, but we've been rather busy networking to be able to make sure that our work with not just Ukraine, but also other countries does help in future. And I have also seen great joy and tears of pride, tears of joy when the flag ceremony was carried out. People gave them a standing ovation when the Ukrainian flag came on. There was a lot of outpouring of emotion during this process. I can understand why, because this is very, very close to some of us being in Europe, but also something that was quite touching was that the United States was represented in a very, very big fashion in this particular arena as well. And all this was possible because I had a ability to be able to come here with the help of the fellowship who notified me that this is what's happening. And it was a chance that I was not going to miss. I also found that whilst I was talking to certain people about the education that is lacking in certain countries, and that was something that touched me a lot. And I have been very lucky. Okay, I'm here because the education was possible, and because my family made sure that I was educated. I've been showered with grace, having an intellectual father who believed in education for his daughter. Education is a fundamental right to be extended to all girls and boys. Even with a basic schooling, it makes a major impact on a girl's earning potential, allowing her to rise above the cycle of poverty. The girl's education transforms communities, countries, and the entire world. So the girls who receive an education are less likely to marry young and more likely to lead healthy, productive lives. They earn higher incomes, participate in the decisions that most affect them. They build better futures for themselves and their families. They strengthen economies, and they reduce the inequality that exists currently in many countries. It contributes to more stable, resilient society, to give all the individuals, including boys and men, an opportunity to fulfill their potential. But education for girls is about more than just access to school. It's also about the girls feeling safe in classrooms and supported in the subjects and careers that they choose to pursue, including those in which they are often underrepresented. So when we invest in girls' secondary education, the lifetime earnings of girls dramatically decrease. National growth rates rise. The child marriages decline. The child mortality rates fall. Maternal mortality rates fall. And the child stunting drops. The gender disparities in education persist even today. So despite the work that we've been doing, we still have more work to do, both from the Rotarian point of view, as well as from the other NGOs' point of view, and from the government point of view, who are making sure that the girls are educated. Now, worldwide, if I tell you a figure of 129 million girls which are out of school, it will astonish you. It certainly did astonish me. Only 49% of the countries have achieved gender parity in primary education. So at secondary level, the gap widens. 42% of the countries have achieved gender parity in lower secondary education and 24% in secondary education. So there are many reasons to the barriers to girls' education. The barriers can be of poverty, of child marriage, and gender-based violence. They vary amongst communities and countries. Poor families often favor boys with education when investing. In some places, the schools do not meet the safety, hygiene, or sanitation needs for the girls. In others, teaching practices are not gender responsive. And they result in gender gaps. So the gender gaps persist in learning and in skills development. So my point here was to make sure that I did meet people who were trying to do this as well. I visited them. And one thing for sure, when they asked me, what would you do? And my issue would be, I would not settle for less if I am the provider and the giver. So I would expect them to strive for more. I would encourage them to strive for more. And I would say, you have got a finite time on this earth. Do not waste a single minute of it. Ask any person who's been given a diagnosis of a terminal illness, and they'll tell you how precious the time is. So since the timing that you're born, to be educated, to be able to help others to do the things that you want to do, to be able to make this world a better place, the time to start is now. Every hour, every minute, every second, make use of it and achieve whatever you want to achieve and aspire to achieve and make a difference. Just don't think about it. Go for it right now is what I would say to anyone who wants to do. Each of us has got a single life full of purpose, and we all can dream of peace in the world, but that's not going to be achieved unless and until we put in practice our deep understanding of a drive for change and the need to drive for change. Now, to do that, it needs action. Rotary, I found that has got this whole system in place to be able to take action. And I see action, I saw from Rotaract, I saw a massive amount of action that they've taken and the difference that it's made. And from every generation, it needs future generation, definitely, and current generation, of course. And we can learn from the past generations, the mistakes they've made, to be able to correct them. And I see the future irrespective of the economic successes of the parents or the social status or the color of your skin or the religion that you believe in. You are able to achieve and take action and aspire to your dreams to make this world a better place. If you don't like hunger, if you don't like poverty, if you don't like climate change that's occurring, corruption, injustice, inequality, then begin to change. Change the world. The future is in our hands. The future is in the hands of our generation, which is coming up. And I would say do it now. But I can't change the world alone. I need people with me. You will need friends, colleagues, goodwill of strangers, and some guides who will help you get to a place where you can find someone to walk with you on your journey. And this journey can be made much more smoother if you have people with you. And I find that exists already in Rotary. These last decades have seen the worst of the humanity in the torture that has been reported, in hunger that's been reported. But I still have hope because I've also seen the best of humanity. And the best of humanity that I saw was in unbelievable places when everybody just got together. And that was in the National Health Service. I have to say that if a casualty comes in, everybody forgets their rank systems. They just want to make the best they want to provide the best treatment for the patient that comes in, for the casualty that comes in, to treat them. There is no ranking out there apart from the person who are obviously, we are conducting a resuscitation, then there is a possibility of having the whole team. But the teamwork itself is very, very important. And there you find this entire gelling of the people together. And this is why I'm filled with hope for the humanity. I'm also filled with the hope when I see young people combating climate change, striving to bring equity to the people of our planet, where none exists in certain areas of this world. And when I see millennials working really hard to improve themselves and the lives of their families, volunteering selflessly to help others who are less fortunate than themselves. And it fills me with great hope that across the world, there are these great young men and women who are raising their children to be good for the good of the world. In so much of this bad part of the world where this evil exists, there's good in this world. And I think the good in this world far outweighs the evil. And I want to say that I would like to be able to see this in future collectively, how they have this formidable power to bring about change for good. I know that our planet is secure in the hands of our young generation and the future generations to come. But there are things to do at the moment, and that include all sorts of disasters that are happening currently in this world, Ukraine being the prime one at the moment, which everybody's focused on. Since February 24th, it's been nothing but mayhem in that country. It's been destroyed to such an extent it's razed to the ground. It's like, for example, Mariupol, as if it doesn't exist, as if it never existed. Its history is wiped out. Its buildings are flattened. we know that this is not the first and this will not be the last, but we want to prevent it. And the first action of any government is not that of war. No government wishes it. But if there is war, then I'm afraid we all have to deal with it. And hopefully we will be there to help others to sustain this kind of atrocious episodes that they're going through. And I'm calling it an episode because I'm hoping that it'll end soon. I'm hoping that this will not be any longer than what it is now. At the same time, I also want to say that there is something recently that I saw in AP News that was reported a couple of days ago. And this is the 5th year running for the drought that's in Somalia. The last 4 decades have been very, very dry indeed. And they reported a mother having lost 4 children in the year, called Ovlio Hassan Salad, and she has watched her 4 children die. And this drought in the Horn of Africa has taken them one by one, and she did not have the soil good enough to be able to bury them because the soil has been so dry. And she walked, taking her, I'll read this, what they've actually reported. AP News says, now she cradles her frail and squalling 3-year-old Ali Osman, whom she carried on a 90-kilometer or 55-mile walk from her village to Somalia's capital, Mogadishu, desperate not to lose him too. Sitting on the floor of a malnutrition treatment center filled with anxious mothers, she can barely speak about the small bodies buried back home in the soil, too dry, even for planting. Deaths have begun in the region's most parched drought in 4 decades. Previously unreported data shared with the Associated Press show at least 448 deaths this year at malnutrition treatment centers in Somalia alone. Authorities in Somalia, Ethiopia, and Kenya are now shifting the grim task of trying to prevent another famine, or this famine, current famine. I think Rotary has got its work cut out. It has got a lot to do, and there's a lot to be done in the world. But now that I've seen what the Rotarians can do and are doing in such numbers, and to be able to donate so freely, to be able to give help even before the help is asked, I am filled with hope and I'm filled with joy. And with that, I'm going to rest and say thank you very much for inviting me to talk on this subject of teamwork and helping others. If I can answer any questions that you have, I'd be very happy to. Thank you very much for your attendance. Thank you.
Thank you, Dr. Shah. Shobhna, thank you for that talk. Been very, very interesting for us to hear that. You've clearly had an amazing experience at the Rotary Convention in Houston. Let me start my video. There we go. You've clearly had an amazing experience at the Rotary Convention in Houston, and it would seem as though our programme, which you'll have heard a lot about on empowering women and girls, has clearly made a big impression on you and inspired you and fitted what I suspect is something very much a sort of ongoing passion of yours anyway. So I'm pleased to see there's that link there, that tie-in. What can Rotarians do individually or through their local clubs to make a change in this field?
I think it's a very good question. Thank you very much. It's a situation where I feel that individually we can make a whole lot of difference, but collectively we can make a whole lot more. We have all these countries which are striving for our attention, to be able to help them, to recognize them, to make sure that we give them both things, the tools to make them independent where it is available, where it is not available, to at least provide them with the nourishment that they need now, so that the babies are not dying, infants are not dying because they are not having nourishment. If a woman has lost 4 children, is what is reported in the AP News here, it becomes a difficult situation for them to carry out their normal lives and even to carry a baby to term. I have seen something similar in Ukraine, for instance, because of this immense amount of anxiety that the pregnant moms had gone through. There were a very high proportion of premature babies being born, low birth weight babies being born. Babies were being born at train stations, underground train platforms, and to be resuscitating them in that particular environment is something which nobody wants to have to do. But unfortunately, that's exactly what they were faced with in a similar fashion in this place, where they have to walk. I could not believe what I was reading, that there would be 55-mile trek that this young person had to take just to be able to take a 3-month-old frail child to this nourishment center to be looked at. Now that is in 21st century. If it's not embarrassing for the governments and the people in charge, then I think it should stir us to be able to do something about it. And the way in which we can do that individually is to make sure that we know which countries these are. We make sure that we have projects which are going to help them. And at the same time, we can apply for grants. There are possibilities of doing that. We can have donation drives, funding drives, people who are very happy to donate, which I did not even think that there would be. But having been involved with this situation, I'm very, very filled with hope, with high hope and aspiration that yes, it will happen.
Yes, thank you. It's interesting that Rotarians are very often, as is well illustrated in Ukraine, well able and willing to help, particularly with initially with donations of cash funding for projects. I'm sure, well, I know that we are an organisation, people of action, who are looking to get involved more than just simply writing out cheques and sending them off. Lots of clubs are looking to support the health systems and other activities in less well-developed countries. Just, if you would, just reflect back on your travels in your medical specialities, and what ideas have you seen in your travels that we Rotarians may be able to develop or support, get involved with the development of?
I think that's another very good question indeed. I have been working in the National Health Service for a number of years, and one thing for sure that comes to mind immediately is that there is a ability to be able to teach the countries which have got less of an education, or possibly, as I was listening to one of the Rotarians telling me about in their country, and there was only one anaesthetist for about 19 surgeons who were able to operate, but because of the lack of that, they had to operate under local anesthesia. So we could make sure that the training is there from the medical student type onwards, to be able to make sure that they are trained, given fellowships to be able to come to different countries. We train them, they go back to their country and they help out. That will be one way of dealing with it. And I think we have got ability to be able to do this even without them traveling anywhere. Now that this whole new arena of augmented reality has come through, we've got software to deal with it. We can see in real time, and we can actually stop when you wear an AR glass, you can actually stop it at the time to be able to say, okay, now I'm going to enlarge it further and I'm going to look at what the issue is, and then we're going to come back with a problem solution of this particular problem that they're dealing with. So to have that technology being transferred into medicine, at the moment it is very much industrial, and less so in medicine. And although we are doing robotic surgery, but that is where you've got huge hospitals having Da Vinci and other robots working. And that's just not a possibility in underdeveloped countries or developing countries. I think much more so in a smaller scale. And also now that we have internet, literally, I mean, I know that there are big billionaires giving away their ability to be able to have the internet in places. I'm sure they'll be able to, we can make them do it for other deserving countries and departments. So once we have a good internet established, then we can use things like, I mean, we've all been using Zoom during this pandemic. We're so capable of it. None of us even knew that existed. So now we'll ask a question. How would you like to have your meeting? Would it be on WebEx or Zoom or MS Teams? I mean, now we've got choices of this. The things like WhatsApp and Telegram are helping us communicate with each other. And I have already got in pipeline 2 of those that I'm following through, and one of them is for orthopedic surgeons. And I have Canadians and I have United States orthopedic surgeons, and I have also United Kingdom. All 3, we are trying to join together to be able to help the Ukrainians presently, and then anybody else that needs in the trauma or anywhere in theater of war. The second one is of the neonatologists. And I would like to also say that with the fellowship's help and people wanting to help us, we are also establishing a continuous ongoing medical professional and also nursing professional if that's what they want. But currently it's all medical because that's what I'm dealing with. And we are going to continue with those professional guidances as well, should they need it, and support wherever they need it. I have got very, very good support in Canada for that. So once this whole thing is set up, watch the space, and we'll be able to let you know about these 2 programs, how we got on.
Yes, I'm sure you'll be interested to hear that. Thank you. It's an interesting twist you bring in there to what helps with health development and health support. Is this one of actually making sure people have decent internet connections and facilities is yes, not an area I'd thought of before in terms of how that could help in just whether it's training, support, simple knowledge, whatever, for doctors and others that are trying to help and develop things in the countries. Moving into the field, because that was sort of covering the sort of health side of things. In the field of disease prevention, of course, that's important. I imagine clean water is key. We've had one of our previous InFocus talks on that. And you talked movingly about the drought and the famine in Somalia. That's led Tommy Davis to ask this question: how can we get more involved with the famine happening in Somalia? What can we do in our communities to help?
I think I have been attending a meeting with I think it's called WASH, and I'm so sorry, I don't have that information right now in front of me, but I'll be able to tell you. I've actually attended this once for providing clean water in Ukraine. And so they have got already something in place. Something similar to that would be quite helpful. In Ukraine, they have water, but they also need to purify that. So we can use purified tablets. In Somalia, we don't have it. So that would be to be able to make sure that they get it in the first instance. So, anything from boring wells, etc. From that point of view, I see it happening. I also see the fact that in the beginning, you will have to provide them with the tools and everything to be able to deal with that in future, and then also make sure that it's a continuing process. So not only for them to drink, but also for them to do the agriculture so that they have their own independence. Unless and until that is provided, I find that it's going to be a little bit difficult to get a permanent solution for that. It's been happening for so many years now. And with the climate change, that's another thing. I know that this is not something everybody wants to hear about, but this is true. Climate change is there and it is happening. And we are looking at 2030 to make a substantial amount of change in our, well, it's starting from the automobile, certainly in United Kingdom, as far as I can see. This is where we're going to hopefully try and do something about it. Amongst many things, COP26 has highlighted so many issues. And maybe we will go back to a slightly cleaner and better version of the nuclear power. I don't know what the answer is. There are many, many solutions, which some of which are good, some of which are popular, some of which are not popular, some of which are associated with false information, disinformation. And that's something which needs to be stopped. And I think as far as the prevention is concerned, this particular issue can be reversed very much. If you see the Brazilian rainforest being destroyed, big companies are associated with it. I will not name the company, but that company was is based in the United Kingdom, and they are working for the big companies which are supplying people with food and rations and things like that. And they have been implicated in Brazilian rainforest destruction. Now, those are the things which we need to put a stop to, and to let people be aware that more and more trees need to be planted, more and more green needs to be coming back. The soil erosion has to stop. There's so many other aspects that they can do. I'm not an expert in that by any form of reach, but what I have seen and what I think that they are trying to tell us to do makes a lot of sense. And if we get educated, each one of us, into recycling, into making sure that our water is not wasted, and to be able to help them whenever and wherever they need help, to be able to make them self-sustainable. Now, that is where we are coming from. In Sierra Leone, I was talking to one of the Rotarians. They were telling me about the infant mortality being unacceptably high maternal mortality, because there were not people who were educated enough. Now, I feel that the climate change also needs the education. Even if we are educated at our degree levels, we're still not educated enough about the climate change and how we're going to be able to deal with that in future. Population is going to increase. Soil erosion is going to happen. We want to be able to stop that. Landslides, we want to be able to stop that. Unnecessary interventions under the earth, like fracking, it has destroyed some parts of that. Whether it's really something that is substantial or not, we need to look at it. We need to make sure that if that is an issue, we need to deal with it. If that isn't an issue, what is the issue? And we get to the root of the problem, and we have a solution for it. And sure that our generation is more than capable of doing so in future, because I have full trust in our future generation that we will do that. We will get it better, and we will make this place a more peaceful and a more habitable place to be in. And maybe we won't have to go to Mars. You never know.
Well, I think that's probably a little bit beyond Rotary's scope at the moment, organising the Mars lander. But what you're saying just illustrates so much of what Rotary is doing across all of our 6 areas of focus, and how they all link back into each other. There's no one answer to the issue of, let's say, water supply, without thinking about the work we do in economic development and, for example, provision of tools through tool aid and other things, so that they can construct the infrastructure in the areas where they need to put up water purifying systems or whatever. And we of course have our aqua boxes and the like, doing water purifiers, and our newest area of focus, environment and climate change issues, which we're spending a lot of time on at the moment. So there's a lot of linkage there. Thank you, Dr. Shah. That's very good.
I just want to say one thing, clarify one thing. Please. I'd love to go to Mars. I would love to go to Mars on that. I'd love to go and explore and see what this is all about. And more exploration is needed. More of the scientific data is needed. It's just a beautiful world out there. We want to see all the stuff.
Indeed, there is, and I know you have some expertise in diving and diving medicine. Well, of course, that's another whole area of exploration that I've touched the surface of, and you've obviously done a lot more than I have. So, however, just to move back to the subject of this evening's talk, we've got a question from Dr. Ederer mentioning special thanks to Rotary, particularly in Britain and Ireland, for the support of Ukraine, which you've talked about as well, through our Health Professionals Fellowship, especially to you and to John, the chairman, Dr. John Phillip.
Yes.
Have you seen the impact of some of the projects that have been run through the disaster relief grants, or are there examples of things extra we can do through the use of the quite substantial amount of money that is available through the disaster relief grants that we have in the Rotary Foundation? So, how can we help all of that work?
I think certainly we could do that wherever the disasters are. Currently, I can only see the disaster that's happening right next door to us, and that's in Ukraine. And they are ongoing needs for a lot of infrastructural work that we need to do. Some of the hospitals have been destroyed. Some of the facilities have been destroyed. Major townships have been destroyed. They will need to be able to the rebuilding is going to be a very important aspect of it in future as well. But currently, what is happening is that there's a massive displacement of population. Now, if you can imagine, approximately 10.4 million of the internal displacement, they are still living not in their own homes, but in shelters or in places that are provided in different areas. And there are countries around, the red countries are all supporting them, including the United Kingdom, although we're not a red country, but still we're supporting them. We're getting the Ukrainian refugees in. We are making sure that they are healthy. The vaccination issues have been sorted out, because some of them are, very few of them have been vaccinated, like 40% need vaccinations. There is an outbreak of polio, etc. It's not because there's a lack of vaccines. We've already talked directly. I myself have talked to the people concerned, the equivalent of the JCVI in Ukraine itself. The issue happens to be that the population are moving. Some of them are not able to, and this is a theater war that they're living in. This is not a normal situation where I don't know how often, every now and again, you hear this irate sirens and you run for your life and you take cover. These are not the normal times for them. So when before that is achieved, we will have to be able to put in a lot of effort to be able to bring up their health sector to a level at which they can function at the EU level I'm talking about now. They can look after their patients. They can make sure that surgeries are carried out by correct instrumentation. Their equipment is so old and ancient. They're very good at repairing things. I mean, that's one thing I have to say. They're excellent at it. And I've seen so many countries doing that. But you shouldn't have to do that. This is the 21st century. You shouldn't have to work with something of an X-ray unit, which is probably about, I don't know, 20 years old, and you're fixing it every few minutes or something. You shouldn't have to deal with that. You should have to have a intervention that carried out very smoothly, so the operating can take place, so that the healing is better, so that the rehabilitation after that is better. Because here we're dealing with very, very young people who are at the front line, who are then going to come in injured, and they need to be able to rehab, to be able to get on to their normal lives again. So all this will need help, and so we need a phenomenal amount of people, money, equipment. We need. And more than anything else, I think what the world has shown is compassion, and has so much compassion in the world now than I've ever seen before for a country, for its people, that it actually lets me have my faith back again in humanity.
That's good to hear. Just I had one question just come in, which takes us back a little bit to what we were talking about earlier on, which is the education and empowerment of girls. And the question is one you may have had some experience of or some thoughts about from Ray Dixon. How do we implement the education of girls in countries which have gender segregation and practices such as FGM without antagonizing local leaders?
It's a very, very delicate situation. And I understand where this question is coming from. But unless it's a vicious cycle, it's like a catch-22 situation, I suppose, not a vicious cycle. In that if you are educated enough, then you will have a lower rate of FGMs, etc. You will have a higher rate of educating the children, and the children they are in a safe place. And in Western Africa, I won't name the countries or anything, but there have been mass kidnappings of these children by certain factions, and up to 250 at a time. And people like Michelle Obama and other people have had to, intervene to be able to have them released. And so people are scared to even send their children to school, the girls to school. So there is a lot. In each country has got its separate dynamic, and we've got to deal with that dynamic in that country currently as to what's happening, and to bring in an educated person in a health sector who is bound to give some sort of a help, which starts from schooling them in segregated areas, but schooling them and making sure that the sanitation for the girls and everything is provided and that is available at all points. Safety is available and guaranteed. And then we can go a little bit further, because those girls are then going to grow up to be the women that are going to help the other girls and other women. Yeah. So I saw as one of the ministers in Afghanistan talk about this. I felt very empowered that, yes, there are people who would do that. But at the same time, she was talking with her life in jeopardy type of a situation. So she needs security too. And we need to be able to make sure that if you invest in this situation, if you invest in making sure that even if they have a possibility of having an education online, even that is a possibility. And we could do that to help them. And they don't need to be in a situation where they are unsafe. Yeah. But to get that much of education, then child marriages are going to be lower in numbers. Then you have FGMs lower in numbers. Then you have got a higher amount of people who are then able to earn more because they've already got those qualifications.
Yes. It's all cycling back into that whole breadth of things. There's no one simple answer. And another interesting point you made is there's no one answer applies to every society as well. So thank you. Right, I think we're coming towards the end of our questions now, but there's one interesting question here, which is from Janine Birtwhistle. Shobhna, she writes, you're a member of the International Rotary Fellowship of Healthcare Professionals. So it's about the fellowships that Rotary has, and your particular speciality and interest is healthcare professionals. And yet you're not a Rotarian, or at least not yet. What attracted you, and how can we attract other non-Rotarians to join our fellowships, whether it's the healthcare professionals or the other many fellowships we have, so that they can share their expertise and passion, even if they don't want to join Rotary?
Okay. It's not that I didn't want to join Rotary. I have to say that. I almost came in accidentally into this arena because I was looking after the refugees, and then I had a little meeting with Dr. John Phillip, who is our chair for the fellowship, and we had a chat, and he said, yes, you have got a lot to give to be able to help the Ukrainians, and I'd like you to come on board. I'd love you to come on board. And then I then became he granted me the full lifetime membership. of fellowship. And I said, can I become one? Sure. Are you sure about that? Because I don't have to be a Rotarian to do that. He said, no, you don't have to be a Rotarian to do that. So Herbert, Dr. Herbert Edra, he's our vice chair, and Dr. John Philip, we're both were very much in favor of me making sure that as I stayed there as a medical advisor and global transportation coordinator. So that's how I came into it. Now, as far as other people are concerned, I think the more they know about what we're doing, the more they are interested. So networking at all points, making sure that you use your social media to a level at which you are able to give out the information that this is what we're doing, this is what we can do. And you can come in and you don't have to have a full-on Rotarian membership to be able to do that. But I'll tell you one thing, I couldn't have done this job without the Rotary people around me, supporting me with this massive, massive support. I just couldn't have done this. So I think it's very good to come in, but it's very good to stay and then become a member and join. And I am going to, but I'm taking my time to see which particular one will I join so that I can give my best to them. And I can have them use my, resources or my knowledge. Or I'm very happy to. I'm giving it free of charge anyway. So it to not just to one place, but to a whole lot of them. So I think I'm doing a lot. But it would help, to say yes. I used to begin all my sentences with "I'm not a Rotarian," but now I don't do that. I say I'm a fellowship member, and a very proud one too.
Shobhna, you are a Rotarian. You just haven't actually gone through the induction ceremony yet. We're delighted to have you working with us and to support you as well. I'm just going to read one of the several greetings and thanks that have come in online. And this one reads, Dr. Shobhna, you are just so adorable, wise, experienced, and a very inspired woman. Thank you so much for your leadership and guidance.
Thank you so much.
I think that says very much of what I would like to say in terms of thanking you for what you've talked about tonight. I know we've all found that interesting, inspiring, and we've learnt a lot. It's re-emphasised the need for us all to recognise the breadth of what Rotary does, how there's so much interlinking between it all. No one area supports or works entirely alone. They're all supporting each other. And it's important that you've emphasised that in the breadth of what you talked about with us tonight. So I'm going to leave it at that. Thank you very much for all you've talked about. And I wish you well in your future endeavours, wherever they may be. And we look forward to hearing from you when you do finally decide to join a Rotary Club. So thank you, Dr. Shobhna Shah.
Thank you so much indeed. I really, really appreciate your giving me the chance to talk to so many people. I want to say what a wonderful job that you're doing. I shall be definitely going on YouTube and looking at your other programs that you already put out. So thank you once more for giving me the opportunity to do so. I wish you all the best.
Thank you. And good night.
Good night. Bye.
Before we completely finish, I will just remind people, I did say earlier on I'd talk about where we're going after this. The end of our the last of our series 1 of our InFocus talks. The first of our series 2 starts next month. In fact, we're moving the times to Wednesdays, the second Wednesday of each month at 7 p.m. So it's a change of day and a change of time. There will be people who've not been able to get to us on a Thursday evening at 5, so we thought we'd make a bit of a change, and other people may then be able to join us that little bit later. And our first InFocus talk in series 2 is on Wednesday the 13th of July at 7 p.m. So it's Wednesday the 13th at 7 p.m. We'll be following largely the Rotary themes for each month during the year, and the first one is the new Rotary year transitions. And the title of the talk, which will be given by Dave King, is Telling Rotary's Story. Dave King is, many of you will know the name, I'm sure, is a member of the Gosport Rotary Club in Hampshire, and he's been the editor of Rotary magazine for the past 5 years. He's a journalist by profession, and he currently teaches journalism at a London university. Transforming the way we tell Rotary's story into something that really captures the attention of the intended audience could transform how we're seen as people of action within our communities. It could bring in volunteers, donations, fresh ideas and potential members, as well as a host of other benefits. And with Dave's vast experience both in journalism and in Rotary, his nuggets of wisdom, hints, tips, do's and don'ts will make this a not to miss session for anyone in the family of Rotary. I look forward to seeing you all then. Have a good evening.